All right. Miss Zhong. Miss Zhong? Hi. What muscle is that, Miss Zhong?
Yeah, what is
Well, we'll go ahead and say it.
what does lateral list?
You've got the correct muscle group, but that's not the vastus lateralis. But you're right, it is one of the quadriceps femoris muscles. So if it's not vastus lateralis, and it's not vastus medialis, and it's not...
What does medialis? What does lateral
Yeah.
list? Yes, us.
Okay, so what are the other two? Vastus medialis, vastus lateralis,
What?
vastus intermedius,
Medius, yeah.
and what's the last one? Rectus
Rectus femoris.
femoris. That's what that is. Rectus femoris.
Rectus femoris.
Yes.
Yeah.
What does rectus femoris do to my knee? What does it make it do? What do we call that?
Okay.
What is the action of rectus femoris? What does it do?
Action.
Yes. So it makes my knee, hold on, let me give you a picture here really quick. The rectus femoris, it does two things, but let's keep it simple. It does that. What do you call that? If my knee goes out, what do you call that? What's that movement called? It's not a flexion, it's the opposite of flexion.
Flexion.
So, hold on, my dear.
Sorry.
That's flexion.
Flexion.
Right, but it does this. What do you call that? What's the opposite of flexion?
Flexion.
Maybe extension?
Yes.
Well, that's abduction. Let's stick with an E. Extension.
Extension.
Yes. Yes. Well, that was flexion too. Oh my gosh, you're killing me. Now I'm confused. Anyway, this is extension of the knee. And that's what the rectus femoris does. It does other stuff, but I'm not even going to go there right now. All right. So what muscle is that? What muscle?
What does
No. Rectus.
what?
Rectus.
Rectus femoris.
Yeah. And it does a extension of the knee.
是 what does
No. Rectus.
rectus femoris.
Yep. And it does an extension of the knee.
Yeah.
So say extension.
Extension.
Cool. I'll come back to you. Good. Miss Walker, why? Hello. Miss Walker, why? What muscle is this?
Rectus femoris.
Yes. What two actions does it produce?
Extension and I want to say like lateral rotation.
Don't say any rotations.
No.
No. How many joints does it cross over?
To the knee and
Good.
the hip.
So it's going to do, you said an extension and you meant to say of the knee.
Mm-hmm.
And then a what of the hip?
Oh, flexion of the hip.
Awesome. Good job. Don't go anywhere yet though. I've got
Okay.
one more for you. What's this muscle?
Vastus medialis. Lateralis. Intermediate.
Awesome! Yes, the last choice. I'm just teasing you, by the way. It is vastus intermedius, yes. I kind of got where you went with the other ones, but anyway. What two actions does that muscle produce?
That one also does knee flexion.
Of what?
And what'd you say?
I'm asking you the actions of this muscle.
Flexion of the knee.
Wow, that's impressive. So this one does extension of the knee, but this one does flexion.
I meant extension.
Oh, okay, good. Extension of the knee. Yeah?
Yes.
Anything else?
Don't know what the other one is.
Good, there isn't another one. Okay, good job, ma'am. Thank you. Miss Walker T.
Yes.
Miss Walker T, what muscle is this?
Rectus femoris.
What are its two actions?
Extension of the knee, flexion of the hip.
Yes. What muscle is this?
Vastus intermedius.
Yes. What 13 actions does it have?
It does all 13 actions of knee extension.
Beautifully said. I like that. What muscle is this?
Vastus lateralis.
And what are its actions?
It extends the knee as well.
And that's it. Thank you, ma'am. It's been a pleasure talking to you. Miss Vincent.
Yes.
Miss Vincent, what muscle is this, madam?
Rectus femoris.
Awesome. What are its actions?
Extends the knee and flexion of the hip.
Awesome. Because of that, could it be responsible for an anterior tilt of the hip too?
Yes.
Yes. Thank you.
Yeah.
Awesome. Well done. By the way, that was not missing from your answer. I'm just adding extra information. Your answer is 100% correct as is. What muscle is this?
Vastus intermedius.
Yes. What actions does it have?
Extension of the knee.
And that's it. Good. What muscle is this?
Vastus lateralis.
Yes. What actions does it have?
Extension of the knee.
Awesome. What muscle, teardrop muscle, is this here on the medial side?
Vastus medialis.
Yes. What actions does it have?
Extends the knee.
Cool. Last question, ma'am. All four of those quads insert into the same place. Can you tell me where they insert?
The knee.
That's actually a pretty good answer.
Right under the knee. On the tibia.
Yes. So they insert into the patella, and then the patella inserts into the tibial tuberosity, which is right under the knee. Tibial tuberosity. Cool. Okay. All right. Thank you, ma'am. We'll take it. Miss Routson.
Yes.
Miss Routson, where do all four quads insert?
They come over the patella and insert into the tibial tuberosity.
We'll take it. That's beautiful. Awesome. All right, ma'am. What muscle group is this?
The hamstrings.
That is absolutely correct. What two actions do the hamstrings produce as a group?
Flexion of the knee and extension of the hip.
Beautifully done. Which is why they are nicknamed the what muscle?
Oh, I know this.
I've only said it a couple times. You may not know it. When I say it, they're going to be like, yeah, that sounds familiar. It's not life-changing.
Okay, I forget. Remind me.
The walker, they're called the walker's muscle because you actually use those actions in walking. Walking is very much a hamstring exercise. I mean, it's an everything exercise, but the point is, they're called the walker's muscles. Cool. Good job. Thank you, ma'am.
Mm-hmm.
Miss Trotter.
Yes.
Hi, Miss Trotter. Miss Trotter, what muscle is this?
The rectus femoris,
Yes. What muscle is this?
the vastus intermedius,
Yes, ma'am. What muscle is this?
vastus lateralis,
Yes, ma'am. What muscle is this?
vastus medialis,
Yes. What action do all four muscles create? I know one of them creates two, but all four create this action. What action is that?
They all create an extension of the knee.
Yes, because they all insert where?
They go over the patella into the tibia tuberosity.
That was beautiful. Tibial tuberosity. That was gorgeous. What muscle group is this?
Hamstrings.
Yes. How many joints do they cross over?
2.
Yes, the knee and the hip. I mean, one head doesn't, but I don't care. So not right now. And so what two actions do they produce?
The flexion of the knee and the extension of the hip.
Beautifully done. What are they nicknamed?
The walker muscles.
Yeah. I'll take it. And what muscle is this?
Oof.
It could be, there could be two that I would easily mistake.
I want to say that's the adductor longus. Or is it the brevis?
I think it's the brevis. But by the way, I do not think that makes you good or bad at anatomy. I think it's actually a very hard muscle to identify on its own. So it's the adductor brevis. Cool. What action does that muscle produce?
Isn't it the flexion of the hip, right? Or is it a rotation?
Is it called the rotator brevis or the flexor brevis?
Oh, it's an adductor.
Oh, good job. You're thinking too hard, ma'am. Thank you, though. You did great. I really appreciate it. Mr. Tate.
Hello, you here?
Hello, sir. We can hear you. Mr. Tate, where do all four quads insert? All these muscles here, where do they insert?
They all entered into the patella.
Yes. And
That's
then
in
where?
the knee area.
Yep, the patella,
Okay.
via the patellar tendon, and
Yes, sir.
then where do they go from there?
Is it? I forget what it's called, a tuberosity or something like that.
Yeah, it's tuberosity found on the tibia, so we're going to call it the tibial tuberosity.
It's a tibial tuberosity.
Cool. So what main action do all four of those muscles create?
Flexion and extension.
Wow. So,
Okay.
so they create both actions of that are in opposition, flexion and extension.
Are you talking about the quads?
Yeah.
Just the quads? I'm sorry. Well, no, because it's flexion of the. Is it flexion of just the hip and then extend, or maybe it's just flexion? But I thought I heard somebody say it was flexion and extension. So I'm thinking maybe it's flexion of the hip and then extension of the knee.
Yes.
Is that right?
One quad. One
right.
quad creates flexion of the hip. Which one's that?
The rectus femoris.
Yes, sir. And all create extension of the knee. That was good. Thank you. All right. What muscle group's this?
The hamstrings.
Yep. What two actions do they have?
Extension. I guess it's extension of the hip,
Yep.
and then flexion of the knee.
Yes. Which is why they have what nickname?
The hamstrings have a nickname.
Yeah.
I'm sorry, I missed that.
That's okay. So they're called the walker's muscle.
The walker's muscle.
Yeah.
I apologize.
That's okay. So and what muscle is this, sir?
Okay, that is the pectineus.
Actually, you're wrong.
Brevis is the brevis.
Yeah, but I was going to say I'm very impressed though because pectineus would be an equally good guess. Does that make sense? Like that's an easy one to
adductor
miss.
brevis. It does.
What is the what's the action of the adductor brevis?
It's gonna adduct the leg.
Adduct the what?
It's gonna adduct the hips.
Yes, it's an adductor of the hips. Excellently said.
Yes, sir.
What's this one? This dark one in red.
The dark one in red is the. I want to say it's the adductor longus.
Yes, I want to say that too. What's its action?
It's gonna do the same as the last. Adduct the hip.
Adduct the what?
I want to say hip again.
I want you to say hip again.
Okay, it's hip.
Good job, sir. What muscle is this in red? It's on the medial femoral compartment, but it's towards the back a little bit.
I don't want to waste too much time because it's not coming to me right off the top of my head. But it's an adductor, right?
Oh, good. Yes, it is. Which one do you suspect it is? It's obviously not the brevis or the longus.
Right. Is it the magnus?
It is. The magnus is the biggest
yeah.
adductor, and it's in back.
I know that one, but you know what? In my head, just because of our lecture once, you said something about it. about a muscle being in the back, and I keep thinking of that word. I'm not gonna say it now because I'll embarrass myself. But yeah.
Okay. Yeah. Anyway, that's good. Good. All right. Thank you, sir. Thank you.
You're
Thank
welcome.
you. Miss Zhong.
Hi.
Hi. What muscle is this?
Rectus femoris.
Yes, rectus femoris. What action does it create?
Rectus medius.
No, hold on. The muscle is called rectus femoris. You're right. That's correct.
Yeah.
But here's what it does. When it grabs my leg, it makes it go out. What do you call that when I go out like that?
Extension.
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 Good. Okay. So what's the muscle name? What's the name?
Rectus femoris.
Yes. And what does it do?
Yeah.
Extension.
Extension. Extension.
Good. All right. Good. You're good. I'm coming back to you. I'm not letting this go. Thank you.
Thank you.
Let's see. Where was I? Oh, Miss Sarno.
Hi.
Hi, Miss Sarno. Hi, Miss Sarno. What muscle is this?
Rapid formulas,
Yes, you are right. Good job. What muscle is this?
Vetus, rado, aras,
Beautiful. Yes. What muscles are these?
hamstring,
Yes. What muscle is this?
adductor brevis,
Yes. What muscle is this?
adductor magnus,
Beautiful. Yes. What muscle is this?
cruciferous,
Gracilis. That was beautiful. Where does the gracilis insert? Do you remember where it inserts? It inserts into something that we have a name for. It's hard to say.
yes,
Pes
has
anserinus.
and psoriasis,
We'll take it. That's good. On the tibia. That was beautiful. Awesome. Last one. What's this?
pectinus,
What action does the pectineus do?
adduct the hip,
Yeah. And by the way, everybody, I realize it might flex the hip a little bit too, but we're sticking with basics. Adduct the hip. Beautifully done, Miss Sarno. Thank you.
thank you.
Miss Allure.
Hello.
Hello, ma'am. Sorry, I had to switch it up a little bit, so break up the pattern. What muscle is this, ma'am?
Rectus femoris.
Yeah. What two actions does it produce?
Extend the hip. No, extend the knee, flex the hip.
Yes. Good job. I like that. What muscle group's this?
Hamstring.
Yeah. What do they do?
They flex the knee.
Yes.
And extend the hip.
Yes. Yes. It's amazing how you knew there was a second action there. And what?
Sorry.
And what are the? No, you're doing great. I'm just having fun. What are the names of the three hamstrings?
The three hamstrings are bicep femoris,
Yep.
membranosus, semitendinosus.
Beautiful. Which one's most lateral?
Semitendinosus. Oh, bicep femoris.
Yeah. Awesome. You're on fire. You really are. It's amazing. Okay. What muscle is this?
Abductor magnus.
Adductor magnus. Yep. Cool. What's its main action?
Abduct the hip.
Yeah. Beautiful. And what muscle is this?
Gracilis.
Yeah, gracilis. I think it's gracilis, but I like gracilis. We'll take it.
Sorry.
No, don't be sorry. Where does it insert?
And inserts at the pin.
Inserts at a place called something. I know, actually I was trying to be helpful, even though it sounded like it was. But this place, it's on your medial proximal tibia, but it inserts with two other muscles, and so we call the place something.
The patella, the pin as
Yeah, Pez? Pez?
Anseritis.
Anseritis. Beautiful. Okay, just about done with you. Hold on. What muscle is this?
Is that the IT?
It is the IT band. You're 100% correct. This is the iliotibial band. What's the muscle right up here associated with it?
Tensor.
Yeah, you're doing great. Tensor fascia lata.
Fascia lata.
What's one of the actions of the tensor fascia lata? It's kind of in front.
Extend the hip.
Kind of in front.
Let's see.
If you kick your leg out in front of you, what do you call that? Your femur out in front of you.
Flexion.
Yes! Awesome. Thank you, ma'am.
Thank you.
Good job. Good job. Mr. Blygen.
Yes.
You okay there, sir? Kind of cut out.
Yeah, I'm good.
Oh, good. All right, Mr. Blygen, what muscle is this, sir?
That is the vastus medialis.
Oh wait, sorry. No, it's not.
You said no?
Yeah.
Rectus femoris?
Does it look like crossed over the hip?
No. Wait. We're looking at the vastus intermedius.
Yes, sir. Vastus intermedius. And what are the actions of the vastus intermedius?
To extend the knee.
Yes, to extend the knee, and that's it. Well done. Thank you, sir. Okay. So, what is this muscle group?
The hamstrings.
Yes. What are their actions, sir?
To extend the hip and flex the knee.
Extend the hip. Yes, perfectly said. Sorry, I had to think for a second. Beautifully done. What's this muscle?
The gracilis.
That's awesome, sir. It's part of what muscle group?
The adductor group.
Yeah. What's its main action?
To adduct the hip.
Awesome. And where does it insert?
In the pons anserinus.
Thank you. And where's the pes anserinus located roughly?
In the medial proximal region of the
Tibia.
tibia.
But you did great, honestly. Medial proximal tibial shaft, I think, is the full thing. But you got it. Really good. Let's see. What item are we looking at right now in red?
That's the sciatic nerve.
Yes, sir. What muscle might be pinching it that I can see right above it?
The gluteus maximus.
It is true the gluteus maximus runs over it. But in this picture, there's this interesting muscle right here that kind of makes like the bottom of a T with the sacrum here.
Oh, yeah, the piriformis.
Awesome. Thank you, sir. Good job.
Can you go back to the quads?
Yeah.
The medialis and the intermedius. I don't know why I got those mixed up.
Well, I think it's really easy. I think it's hard when you're looking at a picture, right? But that's the intermedius, and here's the medialis. The medialis really does make up this medial bump we see on people's legs. Does that help?
Lateralis, medialis, intermedius, and rectus femoris. Okay.
Yeah.
I just forgot.
Yeah.
I know. Okay, thank you.
No, you're very welcome, and that's why we're doing this. You know what I mean? We're just trying to put information back in there. That's great. Mr. Brown.
Hey, Mr. T.
Hey, Mr. Brown. Mr. Brown, what muscle am I looking at?
That's the vastus intermedius, right?
But you made an excellent guess. That I will give you. You made the second with not being right. You made the best guess you could make. But it's not the vastus intermedius. It's a muscle that lays on top of the vastus intermedius. And what is that muscle?
The okay, I can't see you. I like to look at your face while I do it. The that sounded weird. My bad.
No, I
The rectus femoris is the most superficial, isn't it?
Yeah. And does it go all the way down the knee and kind of cross over the hip?
Yes.
Is that what you want to guess?
Yes, rectus femoris.
It is the rectus femoris, sir. Awesome. Okay. What's this muscle?
That one is the vastus intermedius.
Beautiful. And this one doesn't go high enough up to cross over the hip. That's how we knew that. Well, what's this one?
That's the vastus lateralis.
Yeah. And what's this one? This little teardropped one down here.
The vastus medialis.
Yes.
Not medialis. Not. Oh yeah, medialis. Medialis.
No, you're good. So, where do all four of those muscles insert? 'Cause they all insert the
into the patella.
Yes. And then where does the patella insert?
The tibial tuberosity.
Bam! Thank you, sir. Well said. So that creates what kind of action? Because they go across the knee.
Flexion because it's in front.
Yes, but no. So flexions usually do happen in front except for the knee.
Oh, extension because the knee's kind of inverted.
Yes! It's the one little skitty wampus thing. But I really like what you said because flexions usually do happen in front. That was beautiful. What group is this?
The hamstrings.
Yeah, what two actions do the hamstrings create?
Those are the ones that do flexion.
Of the what?
Of the knee.
Yes.
And they extend the hip a bit.
And they extend the hip quite a bit, yes. It's like you didn't want to commit on that one. Yes, they flex the knee, extend the hip. That beautifully said. I love it. What muscle is this, sir?
The one in red?
Yeah, the one in red. Thank you, because there's other ones there. You're right.
That one is the... We're still looking at the hamstrings.
No, we're looking in between this guy's legs right now.
Oh, so that's an adductor.
Adductor, yes.
Adductor longus. That was a guess because I don't know which one that one is.
Well, it is the adductor that is it. They're all found between the legs. They're all found in the medial, but it's the adductor that is furthest back on the medial side. Right? You see how far back it is in the leg?
Magnus, longus.
And the one that's the farthest back on the leg is the adductor magnus. Yeah?
I thought adductor magnus was wide though.
Well, it is, but the picture we're seeing right here is just, I mean, I don't know, I can't really explain it. They're trying to do a two-dimensional picture, but it is. It's the biggest muscle, too, you're right. But it's in back of your other adductors. Like, all your adductors are between your legs, but the adductor magnus is in back.
Okay. It kind of wonky.
Honestly, if I had to represent it with my hand, I'd put the adductors here, like this, but the adductor magnus is behind them. Still between my legs, but behind them.
Hey.
Yeah. Cool. Thanks, sir.
All right.
Miss Estes.
Yes.
Yes, Miss Estes. Before we get to that, Miss Estes, where do all four quadriceps femoris group muscles insert?
Into the patella and then into the tibial tuberosity.
Yes, I hope everybody realizes, by the way, what she's saying, which is correct. They all come together in this tendon, which we call the patellar tendon. It goes in the patella, then goes in this ligament, which is really just part of the tendon. Remember I told you it's all the same fascia, we just give it different names. And that inserts down here into the, what was this area called in the tibia, ma'am?
The tuberosity.
Yep, tibial tuberosity, beautifully said, thank you. Because they all insert down like that, because they all do that, what kind of action can they create?
an extension of the knee.
Beautiful. I love that. Okay. What muscle group's this?
Hamstrings.
Hamstrings. What's their nickname?
The walker muscles.
Really nice. What are the two actions they produce?
They do the flexion of the knee and extension of the hip.
Flexion, extension. Yes, sorry, I have to think about it after a while.
Yeah.
Because I start saying yes.
I know, it starts to mix together after a while.
What muscle is this?
That is the adductor magnus.
Thank you. And I realize you probably memorized the pictures by now, but why should I know that's the adductor magnus and not one of the other adductors?
Because it's the farthest back and it creates the little shoebox in the hamstrings.
It's the furthest back, and you saying it, nobody listens. Yes, that's beautiful, thank you. It can also act like a hamstring because it's so far back, but beautifully said. What muscle is this, ma'am?
Gracilis.
Yeah, where does it insert? It inserts into a special feature.
The goose foot.
Yeah, the goose foot. Yeah.
Pes anserinus.
Pes anserinus, yeah. And where can I find the pes anserinus?
That is on the tibia.
Yes! Which side? If
That
you look
is
at the picture.
Yeah, it's on the medial side of the tibia.
Yeah. And is it on the proximal or the distal portion of the tibial shaft?
And be the proximal.
Proximal medial tibial shaft. Beautifully done. Thank you. It really was beautifully done because you figured it out instead of just memorizing it. That makes me even happier. Cool, cool, cool. What muscle and what item is this here?
That is the tensor fascia latae.
Yes, tensor fascia lata on the, what's it?
Iliotibial band.
Beautiful. Thank you. Beautifully done. What action can the tensor fascia lata create?
That is a is it a flexion?
Yes, because Mr. Brown says that things in front create flexions, and Mr. Brown is correct except with the knee. But yes, absolutely. So could it create anterior pelvic tilt?
Yes.
Yes, it could. What is that thing in red?
The sciatic nerve.
Yep. What could possibly be pinching it in this picture?
The piriformis.
You're on fire. Okay, this one's tough, ma'am. What is this?
Iliacus.
Oh, well, I guess not that tough. What action does it create?
That is a flexion of the hip, or
Yeah.
yeah,
Or you're going to say anterior
or
tilt.
the anterior tilt. Yeah.
Yeah. Cool. I love that. Thank you. Since you're on, let's do one last one. What's this one?
And then that's the psoas major.
Yeah, and what can it create?
Same thing. The
Yes.
anterior.
Flexion of the anterior. Let me ask you, sorry, I said one more thing, but now there really is one more thing. Last one.
Right.
Both this one, the psoas major, and the iliacus insert in the same place. They don't start in the same place, but they insert in the same place on the femur. Do you know what that place is called?
Is it like the? I want to say that. Is it like the nuchal or something?
Oh,
No.
like the nuchal line. That's back of the head.
Oh, that's no. Okay, so that's.
You'd be kind of messed up if that happened.
Yeah, that like a
That's a
little
birth
weird.
defect. I can give you a hint.
Okay.
It's not the greater trochanter.
Oh, okay, it's the lesser trochanter.
Thank you. It's called the
That's
lesser
it.
trochanter. You did fantastic. Thank you, ma'am. Really appreciate
Thank
it.
you.
Thank you. Thank you. Mr. Riedel.
All right, I'm ready.
I love that. Sir, what muscle's this?
That's going to be the rectus femoris.
You are 100% correct. What muscle's this?
Vastus intermedius.
Yes. What muscle's this?
Vastus lateralis.
Yes. What muscle is this? The teardrop one down here.
Vastus medialis.
Yes. Where do all four of those insert?
Into the patellar, which go to the tibial tuberosity, right?
Bam. Beautiful. I love it. So because they all insert down there, what action could they create?
Extension of the knee.
Beautiful. Thank you, sir. What muscle group is this?
Hamstrings.
Nice. Let's get... what muscle's this?
Gracilis.
Yeah, it's part of what muscle group?
The adductors.
Yeah. Sir, the gracilis inserts where?
The pes anseritis.
Yeah, and where can I find the pes anserinus?
On the medial proximal
Nice. Shaft of the...
shaft of the tibia.
Sir, that was perfect. Really nicely done. Let's do... What is this we're looking at?
Sciatic nerve.
And what could be pinching it?
Piriformis.
Yes. And what's this?
Cyriiliacus.
Yes! It's not myeliacus, but yes. And what's this, sir?
The psoas major.
Yes. What do we call them together?
Hip flexors.
Yeah, that was actually a very good answer. And they are. By the way, everybody, he's 100% right. These are your number one hip flexors. But if you put iliacus with psoas, what would you get? If I tell you,
Yeah.
it's iliopsoas.
Oh, that's upsetting.
Yeah, well, you did the hard part. I'm very impressed. You did the hard part. That's just what most people call them, and I like to remind people they're really two muscles. That was good. Last thing coming up for you, sir. What muscle group is this? I'm sorry, not what muscle group. It's one of your spinal erectors. Which one is it?
It's the one that hooks onto the ribs. It's like iliocostals or...
Yeah! Dude, yes! Yeah, that was great. Iliocostalis, but actually what you said, people would have understood. That was awesome. Iliocostalis, love it. What action does this muscle produce if it's working bilaterally?
Bilaterally?
Yep.
Okay, it's gonna extend your spine.
Yeah, and if it's working unilaterally?
It's gonna... tilt.
Yeah, I mean, you're not that far off, sir, but we call it a lateral flexion of the spine.
Okay.
I know why you're thinking tilt, because the stuff down lower can tilt your hips. Awesome, you did great. Thank you, sir. It's really good. Mr. Placencia.
Mr. Tasca.
Mr. Placencia, I hope you've been paying attention, sir.
Yes, sir.
What muscle is this?
That is adductor magnus.
It is. How do you know that?
It's the most back, most posterior of the adductor.
Yes, so it's still in the inner thigh. It just is the one pushed back. The inner thigh's got some real estate. You can be in the front or the back of it. Beautifully. Beautiful. What action does it create?
It is the interesting one because it's both in the front and the back, so it'll adduct the legs for sure.
Sure, adduct the hips for sure.
Adduct the hips, it'll immediately rotate because it kind of hooks onto the front.
Oh, actually it can. You're right, actually. It's got a big fan. It can also do one other thing. I'm getting really nitpicky. We don't
It
have
can also flex and extend because it's both on the front and the back.
Yeah, it's because of the different fibers, right?
Yeah.
Nicely done. That was really good. Wow. Okay. What muscle is this?
Gracilis.
And where does it insert?
To the pes anserinus.
And what other two muscles insert with it?
On the front we have the sartorius, and then on the back we have the semitendinosus.
That was beautiful. I love how you explained it too. There's one in front coming down, one in the middle, that's gracilis, one from the back that ties the whole knee together. And where do I find the pes anserinus? Should I want to rub it?
On the medial proximal side of the tibia.
Nicely done. Okay. What structure is this and what muscle is this?
That is the tensor fascia lata.
Yeah.
And it inserts into the iliotibial band.
Yeah. In fact, could the iliotibial band be considered a tendon of the tensor fascia lata?
I would say so.
Yeah, cool. At least we can make that argument. What action does the tensor fascia lata create?
Primarily flex the hip, but
Yes.
it can also abduct the hip and laterally rotate.
never thought about it, but it can probably. Wow. Okay. The student has surpassed the master. So you know the sciatic nerve. What can be pinched on the sciatic nerve?
Piriformis.
Cool. What are the other 5 deep lateral? There's 6, but you just said piriformis. What are the other 5 deep lateral hip rotators?
Okay, we got piriformis, obturator internus, obturator externus, gemellus inferior, gemellus superior, and the quadratus. It's one of the quadratuses, not lumborum, the other one, femoris.
Yeah! Dude, that was really good. Okay, which one is most superior?
Piriformis.
Yep, I hope everybody can see that right here. Which one is most inferior?
Quadratus femoris.
4-sided muscle on the femur, most inferior, and everything else he talked about is right in there. Beautifully done. Hey, I'm sorry, what is the action of the lateral hip rotators?
They laterally rotate your hip.
Yeah, beautiful. What muscle is this?
That is the iliacus.
Beautiful. And what muscle is this?
Psoas major.
Yes, and together they are called the
Iliopsoas.
And the iliopsoas insert into the same place. What is that place?
The lesser trochanter.
The lesser trochanter of the femur. Beautifully put. And you don't have to say femur, by the way. There's no other lesser trochanter. I just was throwing that in there. Awesome. What muscle is this, sir?
That is the longissimus, because it goes all the way up to this thing on the skull.
Yeah, thank you. The mastoid process of the temporal bone. Can you tell me 2 other muscles that insert into the mastoid process of the temporal bone?
Yep. The sternocleidomastoid and the levator scapula.
No. I feel like you said levator before. Levator goes into the sides of the neck. So we think it goes up there, but it doesn't. This one kind of goes from your spine to your head.
Okay. Splenius captus.
Awesome. Thank you, sir. It's been a pleasure. It's really good. Good stuff. Let's see. Miss Hawks.
Hi.
Hi, Miss Hawks. Miss Hawks, what muscle is this?
That's the iliocostalis.
Beautiful. And what muscle is this?
That's the longissimus.
Beautiful. And what muscle is this half of on both sides?
The spinalis.
Yes. And if these 3 muscles work together bilaterally, what do? If both sides are pulling, what do?
They flex the spine. Or, extend the spine.
Extend the spine, that's right, because Mr. Brown said flexions happen in front, so these muscles are in back, so they extend the spine. What happens if they work unilaterally?
Tilt.
Yeah, or we call it a lateral flexion.
Lateral flexion.
Beautiful. I love that. What are these 2 muscles?
Those are the multifidi and the rotatories.
I'll take it. Multifidi and rotatories. Yeah. Can you tell me, and I don't need you to be precise, can you tell me the difference between the multifidi and the rotatories? Is there a difference?
Is it about where they insert?
Kind of. I mean, one you can see in this picture. If you look at this picture, there is a difference between the top and the bottom.
The fiber direction?
Yeah, they all run the same. I'm sorry. I feel like I'm misleading you.
I don't know.
The multifidi cover the sacrum.
Okay.
And the rotatories don't. And the multifidi are longer, that's all. Multifidi tend to go like 2 to 4 vertebrae, and rotatories only go 1 to 2. But I was just thinking about the fact is the multifidi, when you're rubbing somebody's sacrum, you're on their multifidi. That's all I had. You did great. All right, thank you, ma'am.
Thank you.
Oh, Miss Zhong. Miss Zhong, what muscle is this?
Rectus femoris.
Rectus femoris. Good. What muscle is this?
Rectus lateral midi. Sorry.
One more.
Vastus medialis.
Yeah, intermedius.
Intermedius.
Good.
intermediate.
So what muscle is this?
Rest 是 femoris.
Yes. What muscle is this?
Vast 是 intermedia
It's hard. Vastus intermedius. Good.
Yes.
What muscle is this?
Vast 是 lateralis.
Yeah! And what muscle is this down here?
Vast 是 medialis.
Thank you, Michelle. Sorry I keep calling on you, but it's good practice for you. Awesome. Okay. Miss Carodi.
Hi.
Hi, Miss Carodi. Miss Carodi, what muscle is this?
Rectus femoris.
Yes, rectus femoris. If that's what you said, I think you did. What muscle is this?
Rectus lateralis.
Beautiful. Vastus lateralis. Nice. What muscle group is this?
The ham is a hand muscle, actually.
Yes.
It-
The hamstrings, yes. No, you're correct. What muscle is this in red?
It's a minor, adductor minor.
Adductor magnus. Nicely done. What muscle is this?
It's a guslet.
Gracilis. Nicely done. Good. What muscle is this?
Tension Alex.
Yeah, you're saying it tensor?
Tension fascia Alex.
Yeah, tensor fascia lata. Did you say that?
Yeah, tension fascia right.
Beautiful. Tensor fascia lata or tensor fascia latte. That's fine. What muscle is this?
It's iliac.
Iliacus. Really good. And what muscle's this?
Psoas major.
Psoas major. Nicely done. And what muscle's this?
Lateral shooter is
You got it.
You're fine.
Motor.
This, do you want a hint?
No, she doesn't. You got it.
It's a iliacus.
Yeah. Iliocostalis.
Iliacus.
Nice. What muscle is this?
It's a longus.
Beautiful. Longissimus. Beautiful. And what's this one?
Spinalis.
Spinalis. You said it beautifully. It's beautiful. What are these two muscles?
Motor 40 root.
That was good. Multifidi and rotatores. Good job, ma'am. One last one. What muscle is this? I haven't asked anybody yet, so it's going to be hard. It goes from your spine to your head or your spine to your cap.
Spinalis cap.
Yeah, splenius capitis. Good. Thank you, ma'am.
Thank you.
Okay. Miss Matas. Boom, boom, boom. Just about done, everybody. Miss Matas?
Sir,
Oh, good. Hi. Miss Matas, what muscle is this?
rectus femoris.
Beautiful. Beautiful. What muscle is this, madam?
Vastus intermedius.
Yeah, beautiful. My brain's starting to go down here. What muscle's this?
Vastus lateralis.
Nice. And what's this teardropped one down here?
Medialis.
Nicely done. What muscle group's this back here?
Hamstrings.
Hamstrings. Hammies. What muscle is this here in red?
That's the adductor magnus.
Beautiful. Nicely done. What muscle is this?
Gracilis.
Yeah. What muscle's this?
That's the tensor fascia latae, if I pronounced it correctly.
No, you're doing great. Do you see me smiling here? What's this muscle?
That's the iliacus.
Beautiful. And this one, ma'am?
It's the psoas major.
Yeah.
And they flex the hip, right?
Yeah! You're giving up additional answers. I love it. What muscle is this?
That's the iliocostals.
Yeah, iliocostalis. The muscle that connects the ilium to the costals. Beautifully done, though. Beautifully. Which muscle is this?
That's the longissimus.
It's the longissimus. Beautiful. And this?
Spinel.
Yeah. And what are these two?
Those are the rotatories and the multifidi.
Yes. Which one's on top? In the picture.
The multifidi covers the sacrum.
Yes. Nicely done. Oh, sorry. Nicely done. Multifidi follows the sacrum, and it might be multifidi. I think you might have said it right, and I'm saying it wrong, so don't worry about that. What's this muscle? Goes from your spine to your head.
That is the spinalis capitis.
Splenius capitis, but I'll take it any day.
Splenius. Sorry, splenius.
Don't even be sorry. It's awesome. That was really good. All right. Last one. These are the speed bumps of your neck. They go to...
Yeah, those are the semi-capitis.
Semispinalis capitis.
Semi-spin.
That was great, though. All right. Thank you, Miss Matas. That was really good. Super awesome. Miss Munoz. Are you there still? You may not be there, too. Which I understand. No? Maybe not? Okay. All right. Miss Lobitz. We'll take a break here really soon, everybody. You there, Miss? Oh, there you are, Miss Lobitz. Miss Lobitz, what muscle is this?
The rectus femoris.
Yes. What muscle is this?
Vastus intermedius.
Yes. What muscle is this?
Vastus lateralis.
Yes. What muscle is this?
Vastus medialis.
Yes. Where do they all insert?
The tibial tuberosity via the patella and patellar ligament.
Wow. So you just said they all insert in the tibial tuberosity via the patella and patellar ligament. I love how you said that. That's gorgeous. And what action do they create as a group?
As a group, they all extend the knee.
Beautifully said, yes. What additional action does the rectus femoris produce?
Flexes the coxal joint.
Yes, flexes the coxal joint. Yep. What group is this?
Hamstrings.
From lateral to medial, what are their names?
Biceps femoris. Yeah. Semitendinosus, semimembranosus.
Beautiful. Yep, awesome. What are the two actions they produce?
Extend the knee, or I'm sorry, flex the knee and extend the hip.
Absolutely gorgeous. What muscle is this?
Adductor brevis.
Yes. This one?
Adductor longus.
Yes. This one?
Adductor magnus.
How do you know?
It's on the medial femoral compartment.
But so are the other so are the other four adductors. So what?
It's larger.
It's larger and it's further back.
Okay.
It's most behind. Yeah. Good job. What's this muscle?
Gracilis.
Where does it insert?
The pes anserinus.
Yes, pes anserinus. What are their two muscles inserted into the goose foot to make it called the goose foot?
The sartorius and the semitendinosus.
Yes, nicely done. Okay. What muscle is this?
Pectineus.
Beautifully done. And by the way, everybody, if you showed me a different picture of the pectineus and the like adductor brevis, it would be very hard to tell them apart. Like you'd have to really know your anatomy. So part of this is memorization in that sense. What muscle is this?
The tensor fasciae lata.
And what's its tendon?
The iliotibial band.
Beautiful. What muscle is this?
The iliacus.
Yes. What muscle is this?
Psoas major.
Yes. Where do they both insert?
Lesser trochanter.
Yes. What main action do they both produce?
Flex the hip.
Yes. I'm really impressed. It's very hard when somebody's like, what's this? What's that? Do this thing, do that thing, and then ask a question about it. You're really doing great. What's this?
Iliocostalis.
Yes. And this?
Longissimus.
Yeah, where does it insert?
The mastoid process.
Yes. And by the way, everybody, it does hit some of the nuchal line back here, but I'm just trying to overemphasize this mastoid process thing. That's what I was looking for. What other two muscles insert into the mastoid process?
Sternocleidomastoid and the splenius capitis.
Yep, you nailed it. What muscle is this?
Spinalis.
Yes. What do those three muscles, those spinal erectors, erector spinae group, do when they work bilaterally, both sides working?
Extension of the spine.
Beautiful. Nicely done. What are these?
Multifidi on the top and rotatories on the bottom.
What's the difference between the two?
The multifidi expands 2 to 4 vertebrae and the rotatories expand 1, I believe.
That is true. 1 to 2 and 2 to 4. So the multifidi are a little bit longer. And what's one other thing the multifidi does that the rotatories doesn't do? Or one place it goes?
Inserts in the sacrum.
Yeah, covers the sacrum too. Nicely done. What's this?
Splenus capitis.
Yep, it's the one that you told me also inserts in the mastoid process, and you were correct. What's this?
Semisplenus capitis.
Semispinalis capitis. Beautiful. And what's the nickname for these? Semispinalis capitis.
Speed bumps.
Speed bumps to the neck. I love it. You should already know what this one is. What are these?
Suboccipitals.
Thank you. I think that you have answered enough questions. Thank you. You did really well. I mean, really well. Yes, with rapid fire questions. Miss Mejia, you are last but not least.
Let's go.
Are you ready?
Yes, I'm ready.
Can I give you some that we haven't had yet?
Absolutely.
Okay. So we all understand that these should be harder to do. We haven't done them today. Okay. What muscle is this?
He's crunching really loud.
Is he crunching loud?
Yeah, he's giving him veggie chips really loud.
So cute. What muscle is this, ma'am?
The trapezius.
Excellent. What do the upper fibers of the trapezius do bilaterally?
They elevate the scapula.
Yes. What do the lower fibers do?
Depress the scapula.
Yes. What do the middle fibers do?
Adduct the scapula.
Yes. Awesome. Nicely done. Forget about that. What's this muscle?
Is that the quadratus lumborum?
Yeah. I mean, I know it doesn't really look like it, but it is a four-sided muscle. I mean, obviously it's not really four-sided, but it's a kind of four-sided muscle in the lumbar region, quadratus lumborum. Hey, what does that muscle do if it works like unilaterally?
No. Yes, lateral flexion.
Lateral flexion of the spine, and you're 100% correct. And this one actually could like elevate the hip on one side, right?
Yeah.
Your answer was correct. I just want to add to that. Awesome. It's part of what muscle group, by the way?
The abdominal.
That's weird. They're in front. Anyway, very good. I like that. What muscle is this? We've had this discussion many times, not just you and me, all of us.
The internal obliques.
So how do you know that?
Because the fibers are running in. I'm trying to figure out like which part of the rib they're grabbing on, and it looks like the
Well,
the
just,
inner surface.
if you put your hands on your body, if I put my hands like this, would that be kind of the direction they're going?
Yeah.
Okay. And if I put my hands like this, it'd be opposite?
Yeah.
So if my hands are like this, what are these?
Those are external.
Awesome! Thank you. External obliques.
Yes.
And what are these?
I always forget they're on the outside. Those are the internal obliques.
Yes, and they're running as though I put my hands in like this. Yes, I love that. What's this?
Rectus abdominis.
Yeah, what's the action of this muscle?
Flexion of the vertebral column.
Beautiful. Flexion of the spine. It just crunches you. It doesn't actually bend your hip. That's nice. Okay. What's this muscle?
Transverse abdominis.
Yes, those fibers are going straight across. Transverse abdominis. What's this?
Sternocleidomastoid.
Yes. Do you know its action?
Flexion of the neck.
Yes. And because of that, it got the nickname what?
Prayer muscle.
Prayer muscle. Yep. It's a very holy muscle. What muscle is this?
Deltoid.
Yep. You already did that one. What muscle is that in red?
I believe that's the latissimus dorsi.
Yeah, it's a big lateral back muscle, right? And that'd be a good guess. It's the largest muscle in the upper body. Nicely done, latissimus dorsi. Here's another angle on it. What's that?
I think that is Terry's latissimus dorsi. Terry's major.
Yes, it attaches to goes all the way down the inferior angle of the scapula. That's how we know, and you're absolutely right. It goes with the latissimus dorsi, and it is the teres major. I love that you put them together. What are these two muscles?
Terry's major, Terry's minor.
Yes, which one's on top?
Terry's minor.
Yes, and even though they're together, they don't work together. One's going to the back of the shoulder, and one's going to the front. They're going to turn the arm different ways. Awesome. Okay, one more, and then we got to take a break. We've been running, you guys.
Infraspinatus.
Infraspinatus. Really good. That was really good. Didn't you think it was really good? No?
I appreciate that you didn't give me the ones that everyone.
Oh, I thought this was going to be harder because this was like stuff we hadn't even talked about today, and I thought it was kind of mean, but anyway.
You get me with the actions. I know what they look like.
Oh, you don't know the actions.
No, not very well.
Okay, I'm going to put that down there. Ask actions.
Get his little mean notes. Ask her the actions.
I'm going to. Don't ever say that, because now you realize for the next 2 months, that's all you're going to get. Okay, everybody, let's take a 15-minute break, which puts us at, wow, 5:03. 5:03. I'll see you all back. Take a break, please. Please, please, please.
The lines like for the metatarsals. I mean, I know that that's not them.
Yeah.
But like, how is it just like one layer of muscle that's the metatarsals under them?
Yeah. On top, you've got a few extensor brevis muscles there, right, that live on top of your foot. And again, most of the power comes from up your leg again. And so mostly what you're seeing on top of the foot is a couple of small extensor muscles and the tendons from the longer extensor muscles that live up your leg. And the bones. You're absolutely right. I mean, yes, those are the tendons you see, but if you rub down at all, you're instantly hitting those bones. There's not a lot on top. And
So, but like when you're touching it, you're feeling the tendons, but you have to go deeper in to feel the bones. Is
yeah,
that,
but
like,
not
what
much.
you're saying?
But
Oh,
not
okay.
much. It's almost like you see the tendons, and of course you touch them the minute you touch it.
Mhm.
But by the time you're touching the tendons, the bones are right below them.
Okay.
Yeah. And the reason is, by the way, you guys don't need as much power on the top of your foot. We don't have a hard time lifting up our foot. I need the power when I'm pushing my foot down to lift up my body. When I'm lifting up my foot, I'm just lifting up my toes. They're not that heavy. Even my toes are not that heavy. Yeah. It's kind of like, have you ever seen The Crocodile Hunter? And he grabs the crocodiles and he holds their mouth shut. He's able to do that because crocodiles only have about 5 pounds of strength to open their mouth. Because they don't need strength to open their mouth. They just open it. They've got about 250 pounds of power when they close their mouth, which is why you don't want your hand in there. So that's where all their power is and stuff. And your feet are kind of like that in the sense that they're weak on top, but they don't need to be. Yeah. And so there's not a lot of layers or thickness on top. Now, Miss Mejia later will learn that there are some muscles actually between the metatarsals if you go down there. But anyway, still the point is, you're right. There's not much on top. This is a bottom view. Yes, Mr. Blygen, please.
Can you go back one slide?
Of course I can. Please.
So with the tarsals, like with the carpals, they have, isn't there like one bone that's prone to be broken when somebody breaks their wrist? Like the more common bone that's broken, is there one like that in the tarsals?
Probably, but I have no idea what it is. Yeah. Do you have any idea?
No.
Oh, you're right. I would think I would not. I have no idea. Hold on. Most
I think the book said it was the cuboid. I might be wrong though.
I doubt you are wrong, but it's weird because the metatarsals are the most commonly broken bones, fractured in the foot. So that's these white bones in this thing right here, right? The metatarsals are the most broken. It makes more sense because the cuboid and all that kind of stuff is so square and hard, whereas those are longer and I would think they would break easier. I honestly don't even know if I agree with this. I would think the stuff that's broken first is the phalanges. I know lots of people have broken a toe, right? I mean, it happens all the time. They just don't go get it fixed because there's not much fixing it, right? As long as I've straightened somebody's out before, that wasn't pleasant, but there's nothing to do. Once you straighten it out, you tape it up and that's it. And so Google says metatarsals, I say phalanges. Anyway, and probably not the tarsals. And I don't know what the most common tarsal would be. Sorry, sir. That's all I got. Bottom of the foot, you can see the calcaneus, the heel here. You can see how big it really is. It runs back into the foot quite a bit. The talus sitting above it. The cuboid, which kind of looks like a cube. The navicular. And the medial, middle, and lateral cuneiforms. Yep. And you guys see the sesamoid bones? What's a sesamoid bone? Why is it there? Why did they get two here? Are they on both feet? Or just on the right one?
Are those the balls of our feet?
Those are the balls of your feet, yes. But that doesn't really tell me what they are.
Well, I wasn't going there with it, but
I was.
Yeah, I was thinking maybe because like dancers, whatever, they are on the balls of their feet. So I was thinking maybe that's why it's there.
I mean, there's that. Basically, you're right. What's a sesamoid bone? Can you give me an example of another sesamoid bone in the body?
The patella?
Yes, thank you, sir. The patella is 100% a sesamoid bone. It's a bone wrapped in tendon and ligament. And these are the same thing. These are identical. They're just much tinier. And you've got two there. They're in places of high tension. Remember on your knee, it's there to make sure that your femur doesn't shoot out over your tibia. Here, they're made to make sure your big toe doesn't bend all the way back and pop out. Because when you're up on your feet, on your toes, you really could be putting a lot of stress on them. And your big toe is really important to walking. As we all know, we're actually not straight-footed. We're this way, right? So we actually walk on our big toe quite a bit. I don't mean just on it, but I meant that your other digits on your feet are kind of stabilizers. You actually kind of walk heel to big toe. And the other guys on the outside kind of stabilize you. Yes, Miss Sarno.
Yeah, and did a sesamoid bone and have in the hand also?
Yes. So you are very wise. There's also two sesamoid bones, just like the big toe. Remember I said feet and hands aren't so different. Lower legs and forearms aren't so different. There are two sesamoid bones exactly like in this picture, really. Right here below my thumb. They're very tiny. And they are designed to help me keep from popping my thumb completely back, bending it back when I'm doing massage or something. So they are in high stress areas and hook to tendons and ligaments there to keep your foot in place. Yes, Miss Mejia? Oh, sorry. Go ahead, Miss Sarno.
And they make that like a more movement and stronger.
Stronger, yes. Stronger. Little kneecaps in your thumb and toe, yes.
Thank you.
Thank you. Miss Mejia?
What's the difference between the sesamoid and the ellipsoid? Because I think I had those confused.
So an ellipsoid is a definition of a joint type. And you have an ellipsoidal joint. Shoot. Now you're challenging me. You've got, where do you have, in your wrist. I don't really like the definition of ellipsoidal, but the fact is, it's
the gliding one?
Yes, it's like a gliding joint. Yes. And that's just
But the sesamoids are the bones.
But the sesamoids are just bones. It's not describing a joint.
Okay. Okay.
Yeah.
Okay,
Just
thanks.
sounds similar. It's a good question. Here's a cute picture of them all broken in pieces that I don't think really does you a lot of good. Later, we will study about the tuberosity of the fifth metatarsal. This is on the side of your foot, on the lateral side. Did you need something, Miss Trotter? Miss Trotter? Okay. I'm going to mute you because I don't think you know you're unmuted. Okay. Anyway, this is important to massaging, like immediately important. This bump, this tuberosity of the fifth metatarsal here, is an important muscular attachment site. But I'm telling you about it because people working down the lateral side of the foot, coming down from the little pinky toe, often hit this bump and it's uncomfortable to people. Right? You can feel it on your own foot. And I want you to have enough anatomy to know that, like, that's not a knot. It's a bone. It's okay to rub it, but gently. Because some massage therapists just rub over it every time they're doing a foot. And I'm like, you should know there's a bump there, and it's a bump for a good reason. So we'll learn about that too. Anyway, and we'll learn about the fibular trochlea, which is where the tendon of the fibularis goes around, kind of this pulley thing that I was telling you about. But anyway, that's it. I just wanted you to know about this tuberosity of the fifth metatarsal is a bump that's supposed to be there, and just be aware when you're rubbing somebody's foot that it's not a knot. All that good stuff. You can see here how much, like Miss Mejia, like we were talking about, how little is on the top of the foot and how much space is on the bottom. That's all filled in by plantar fascia, muscles, all that stuff on the top. It just does not have a lot. And we see how important the arch is here, though, and how it's formed. And how big the calcaneus is. Yeah. Cool. And the top here where they say the trochlea of the talus, that just means the place that it meets the tibia. You'll never see it in your life because it really is interfacing with the tibia. Yeah, that's it. That's all I have to share with you. I told you it wasn't a lot.